Hi, everyone. I'm Dr. Dan Gartenberg, and today we're going to be diving deep into helping babies sleep better and helping tired parents finally get a good night's sleep. And I'm so happy to be interviewing Nicole Morales, an expert in the sleep health of tired parents and also sleep training babies. So, Nicole, can you just give a brief intro on your background?
Yes. Hi, Dan. Thank you for having me here today. So, my name is Nicole Morales, and I am a newborn and infant care specialist, postpartum doula, and pediatric sleep specialist. I work with ages 0 to 12 years old, and I help them get on a better sleep routine for naps, daytime, and for nighttime as well.
So Nicole just joined our team as a sleep coach, and she's actually been helping me navigate my recent infant situation, trying to get my little baby to sleep throughout the night. And we're going to learn some tips right now for new parents on how to help their children, and also, parents that are still struggling with their kids sleeping throughout the night when they're a little bit older. So this is a big question that me and my wife had when it comes to our children's sleep. But what technology do you think is safe for sleep? Should there be there's a lot of talk about SIDS, not having things in the bed. One thing I've noticed is sometimes parents blast pink noise or white noise too close to the person. So, my sleep tech uses pink noise, but I always make sure it's sort of far away and not too loud. So give me a sense of, what makes a sleep environment safe for children.
Yes. So we always recommend placing your baby on their back and letting them roll over on their own. So if you have the white noise, which we recommend a shusher, to have it away from them. It should be at a shower level noise, meaning if it's too loud, it can affect their brain development. And of course, it bothers them. They're so little and they don't need to hear something that loud. So we do recommend putting it like on the dresser by the bed, or if you have like sometimes people have like floating shelves on the wall, put it up there and just have it at a certain sound like level. That way it's not too much for them. And you want to be able to hear their cry. Of course, sometimes you don't want it to overpower what they sound like, and things like that. And yes, SIDS is really big, unfortunately. Sudden infant death syndrome, it happens, and a lot of times they still don't know why. They don't have enough research. So we do want to prevent that and letting them sleep in their own crib on a flat surface. They don't need a blanket. They don't need to sleep in anything in the crib, just themselves with a passy, and that's it. And we don't recommend having anything in the crib like a lovey or, like a little blanket until they are the age of 1 years old.
Yeah, so I'm happy that we're doing all of the things that you just suggested. One thing that I would add is we also, and I'm sure you're behind it too, is we have the like a sleep sack. So
Yes.
it's almost like a blank, to have them like without a blanket, I feel like is a little bit like,
Right. They need to be correct. They need to
yeah,
be, if they're not rolling over yet, we put them in a sleep sack, or I'm
hmm,
sorry, in a swaddle, sleep swaddle.
yeah,
And then once they start rolling over, they have to have their arms out. And that usually
right.
happens at the age of 4 or 5
Yeah, so
months.
we have like this sleep set. It's like it zips up and then he can
Yes.
put his arms out too.
Yes,
Yeah,
that's
yeah, yeah.
perfect.
Right. Okay. Yeah, and this, I actually said something to a mom the other day. I felt like a little bit awkward, but she was like blasting. It must have been like 80 decibels pink
Yeah.
noise in the carriage. Like, because distance plays such a big role.
Oh,
You could
absolutely.
play something 80 decibels if it's 12 feet away from you, because the perception of the ear will probably only pick up like 60-ish decibels, which I think is 50, 60 is probably where you want.
Yes.
Um,
And of course, in a nursery, if it's closed off and it's much smaller space, it's going to be loud, especially if it's by their bed. So that's why we
hmm,
recommend it like away, like on the dresser or a
yeah.
floating shelf, because it is far and then it does let the sound go all over the room versus just in a closed spot.
Yeah, it's like sort of abrasive. It's like this whooshing sound is playing all
For
night.
sure.
And
And it's too overpowering. Sometimes
yeah,
that won't help them sleep. It's too loud. It's
yeah.
affecting them. Yeah.
Well, just to peddle my own software for a second, I have them fall asleep to the ocean waves in sleep space. And then it fades into the pink noise, but
I
we
like
make
that.
sure it's not too loud.
Right. Good.
we'll also do like a lullaby sometimes. So my next question here. So how can parents choose the safest and most comfortable option for their little ones?
Yes.
So, this can be like a method of helping them fall asleep, soothing them, but, maybe not having them have too much like gastro problems. Um,
Right.
what are your thoughts on
So,
that?
so I always, and I want to touch base about this a little bit. So a lot of times parents think that sleep training automatically means crying it out. That's not what it really means. So when I have a mom or a dad come to me and they're ready to get their baby on a better sleep schedule, whether it's getting them on a better nap schedule, sleeping through the night, not crying before they're going into their room because they have anxiety, I'm not having you come to me because I'm going to just be giving you support and help and to just let them cry it out. We have different methods. We work with a lot of methods that I talk to moms and dads about to see what their comfort level is. That's what I like to see first. And then we move forward. Okay, I give two options. Let's try this one first. Wait a few days. If you feel like you can go a step higher, we'll change the method. But I never want them to feel anxious during this. This is something that we want
Mm,
to help them with and to support them and lift this off their shoulders and not give more anxiety. So, and I do also recommend, like, when you're going into a sleep method or your sleep training, you could start off slow because you don't want to
mm.
just jump into
Oh,
it.
interesting.
And yeah, and like remember, the baby or the child is going from not sleeping through the night and being on a different schedule, and now they're on a more structured schedule. So they are going to be different. They're going to cry. They're going to want mom more or dad. And that's okay because they're going into something different that they're not used to. So
Hmm.
yeah, you could soothe your child a little bit, but we want them to be drowsy and
Right.
not all the way asleep, because once you put them in their crib or in their bed, on their floor bed, whatever age it may be, they're going to wake up and say, wait, I fell
Where
asleep in
am
mom's
I?
arms and
Yeah.
now I'm in somewhere by myself.
Right.
So going into it slowly and then kind of drifting off in increments, we do recommend that. And that's why we do work
Right.
one-on-one with the support, and we do not leave you, the whole time, whether it's a 1 week package, 2 week, or a 4 week package. We're there by your side to support mom as well and dad.
Yeah, and I mean, you want, I guess what you're trying to do here is sort of teach them how to self-soothe to some degree.
Yes.
So is that, and that's why you bring them in bed when they're drowsy, they're still like slightly consciousness. From a sleep science perspective, they're probably in like maybe N1 sleep, like sort of that transitional phase. So like they're
Yes.
slightly conscious but drowsy is when you want to put them in bed.
Correct. Because
Um,
when they're sleeping all the way in your arms and then you put them in, that's why a lot of times they wake up all of a sudden because they're used to training to sleep in your arms. That if we train them to self-soothe and sleep on their own, they'll be fine. Like you go in, do your routine, soothe them a little bit, put them in bed, and then you could pat them, shush them while they're in the
mhm.
crib. That way
That's what
you,
I've been doing. He likes to
yeah.
sit, so I'll put him in. He's like a little bit. So it seems like I'm kind of doing this right. So I put him in. This is good to know. So I put him in. He's a little tired. I put him on his side. I think it makes him more. Is that okay though?
Yeah, yeah. As long as
Okay.
he's in the sleep sack and he's
Yeah.
already rolled over, he's not like a 2-month-old or a
Yeah.
newborn.
He's 5 months at this point.
Exactly. So
And
this
so
is age appropriate.
but if he was another question here. So when does that cut off actually for the listeners? When is that cut off? Where it's okay to put him on his side, do you think?
So when you're putting him on his side, he's able already to roll over on his
Oh
own,
yeah, yeah, yeah.
back to his stomach. So
Right.
that's okay. You're putting him
Okay.
still where he could be able to
Yeah,
navigate
yeah.
on his own.
Right.
Versus like if you're putting a 2-month-old on their stomach, they can't
I
flap
would
over.
never put him on his stomach.
Oh, of course. Yeah.
Yeah,
Yeah.
yeah.
So that's
Um,
fine to do it once he could roll over. And some take their time, some do it at 4 months, 6 months, 7 months. It all depends on their motor skills and when they're doing it.
yeah, so I put him on his side and just like put my hand on his arm and just like pat his butt for a little bit.
Yeah, and that helps.
Um,
And you're not picking him up. You're doing it while he's in there,
uh-huh.
patting him, and then he's good to go. And now he'll fall asleep, whether it's from
Right.
your patting or, and when it becomes an issue, for example, let's say you're giving your baby a passy, which that also helps with SIDS because it opens up the airways.
Huh.
So if you're
I
giving
didn't
your
know
baby
that.
a passy and they keep waking up because it's falling out, now that's becoming
Yeah.
an issue.
Yeah,
So we never
I've
want to,
that was a problem at one
yes.
point. Yeah.
And then we're creating a habit that now we have to remove that. Plus, we're getting them to sleep on their own. So we don't want
Right.
to create two
Interesting.
bad habits. Yeah.
Right, right, right.
And did you
Now
eventually
he's
just
just
take it
like,
away?
well, we had, and this is another thing based on what you were saying, he had a minor surgery and we actually had to take it away for the
Okay.
surgery. Um, Now he's like obsessed with his thumb. But I mean, I think it's really like, you're meeting the parent, from what I'm hearing, it's like you're meeting the parents where they're at when it comes to their comfort, what level with,
Correct.
there's like the Ferber method, which
Yes,
I've
so we
heard
do,
about.
yeah, so we do time
Um,
checks where they go in increments depending on how
right.
involved the parents want to be.
That's the
Then
Ferber, right?
yes,
Yeah,
AKA
yeah.
fervor. And
Right.
then we have the chair method where it's in the room and then we slowly, gradually remove it to where now they're by themselves. And
Yeah.
then a lot of times people do pick the extinction where you are letting them cry it out, but it's not like just all day, all night. You're not just letting them cry like to
Huh.
where they're throwing up because I don't
Yeah.
recommend
That's
your
not,
child is
it's too much.
no. If
Yeah.
they're getting to the point where now they're vomiting and there's snot coming out of their nose, I'm sorry,
Right.
TMI, but
Yeah.
seriously, and they're becoming sick, then we're not, that's not again,
Yeah.
safe or giving them something to remove their anxiety level. So
Exactly.
that's why my favorite one is the
Mhm.
time checks because it's allowing mom and dad to still be involved and going
Right.
in. You're waiting a little bit. You're not just going in right
Yeah.
away when they cry.
And we're
Because
doing
remember,
like, give me okay, go ahead. You remember
yeah,
what?
no, no, because remember, sometimes the child might cry for a second and mom might run in and they're not really awake.
Yeah.
And now you're
Right,
affecting
right. Babies
sleep.
do make weird sounds and
Yeah,
cries and
because they're
stuff.
going through the cycles of sleep, the REM and non-REM.
Yeah. It's
Yeah,
normal for them to like
it's
wake up and,
normal. Yeah,
if they have some weird flash of a dream and they cry and then go right back to sleep.
exactly.
And
Yeah.
usually it's like, I mean, obviously, like if they're crying for like 2 minutes, don't go in. But then when they start crying, what's like the threshold? I mean, I guess it's different for where the baby's at and maybe different situations. But can you give me a sense of like the thresholds? Is it like 10
Yes, yes.
minutes, 30
So
minutes?
depending, right, that's why we like to start sleep training at 4 months because now they're older and now they're starting to really get like, with a newborn, they're eating and sleeping whenever they want. Now we do recommend putting them on a routine. Like if a mom or a dad comes to me and they say, I have a 2 month old, I know we can't sleep train yet, but I'll still work with them with a sleep routine, when to put them on a feeding schedule, the timings they should be taking a nap, how long. So, but it's not going to be like the sleep training with like a 4 or 6 month old
Yeah,
would be.
you're basically doing like the sleep hygiene stuff
Yeah,
that we tell our adult clients to do, but applying them to the baby.
exactly.
We do, red lights. When I think this is a big thing that I think every parent should have. Obviously I'm on like the night shift and I don't want him to have bright lights, so we always just
Right.
make sure all the lights are dim and red.
Yes.
And we have that
'Cause-
ritual when he's falling asleep as well. And then obviously like giving him a bath and feeding him is something that we've tried to
Yeah, because you want to put
yeah.
him in a routine so he knows, okay, I had
Yeah,
my playtime during the day. And now we're winding down. We're having a routine with the bath. Now I get my lotion on, my PJs,
exactly.
and we read a
That's
book. And
that's the
now
wife's job. She'll lotion him
yes,
up and
yes, she
then
gets him wind
hand
up.
him
Yes.
off to
And then
me.
the red light is great because it helps calm, it gives it a soothing environment.
Exactly.
Yeah, we recommend if they are gonna put a light for it to be red. And usually it's a blackout room as well. But
Yeah,
sometimes
we
you
have
want
it
to
blacked
flip it.
out. Yeah.
Yeah,
I think that's a game changer as well.
it
Um,
helps
do you have
a lot.
other strategies besides what you just mentioned for the wind down?
That's pretty much it. We don't want to, we also do also for like the older kiddos, like a chart and it helps them like,
Hmm.
let's say the chart has like, okay, we just finished dinner. Now we're gonna play a little bit, take a bath, get our PJs on, read a book, and then they can put a card in
Oh,
each
cool.
after every activity because it helps them like they're involved, especially when they're older and they understand, for a 2 year old or a 6 years old child, they want to be more involved, they understand more, and they, when we give them the opportunity to do it with us, they feel like, okay, this is my job, it's a task, instead of us doing all of it, not speaking to them, and then just putting them in their bed. Because
Hmm.
again, we're dealing with anxious children that they know, okay, I'm walking to my room now and it's bath time and
Yeah.
I know what's happening next. It's hard.
You're
They
almost giving them agency. They're like thrown into this world. They don't know what's going on, and
right.
you're giving them that sense of
And we're
security.
navigating
Yeah.
exactly.
Okay, I like that. So this is sort of like a two-part question, I guess. One is, how do you identify, this is coming from my personal question right now. So right now, my baby's still sleeping right next to me in in on one of these crib things, like right next to my
Bassinet.
bed, the bassinet. Yeah.
Yeah.
Um, when do you make the transition in your mind from the bassinet to his own room? And then when do you make the transition from, the crib in his own room to like a little toddler bed?
Yes, great, great questions. Okay, so I do work with parents who are room sharing. I am glad you're not bed sharing, and
Yeah,
no,
never bed share.
yeah,
Yeah.
because that's like a number one cause of SIDS. And I know a
Yeah.
lot of parents do it because they're desperate, they're tired, and if baby is with them, they're gonna sleep great because they are with their mom and dad. But we really do recommend, if you are going to room share, have them in their own bassinet in the crib
Right.
in the room, which you're doing. That's great. I would start now because again, he's 5 months, he's getting older, he's understanding more. So I would say at between 3 and 4 months, they can be in their own room. I
Yeah,
would recommend that.
the only reason we didn't do it earlier was because he had this surgery.
No, totally. And
So
there are,
so
and
it's like there's circumstances.
yeah, for sure. And there's some parents who leave them in the same room, and we could sleep train them and they're doing great at 6 months old or 8 months old. It just all depends on, like you said,
Mm,
like if they're having surgery or if something is, a health condition that they do need to keep them in their own room. But again, as long as it's dark in there, you have the sound machine, treat it as if they're in their own room.
mhm.
And to answer your question about in their own toddler bed, we usually recommend 3 or 4 years old.
Okay. That's good to know for the
Yes.
3 years from now. I'm
Yes.
gonna
And
have
when
to
you
remember
do
that.
put them in their own toddler bed or floor bed, you have to also treat it as if they're in their crib, and
Hmm.
nothing around them is hazardous. And you can close the door and go to sleep knowing your child's okay.
Hmm. Okay.
Because again,
They
they
could
can
always get
climb.
out and cause
Yes,
trouble, I suppose.
exactly.
Yeah. Okay. All right. Well, I'm doing one step at a time. I'm gonna have to look forward to that aspect of things.
Yes, for
But
sure.
this was great. I think that our listeners will find this very helpful. I learned a lot from this discussion.
Awesome.
And Nicole is one of our coaches here. I hope that you try out her program. It's definitely helped me navigate my newborn, and follow along. We're going to give you more tips on how to help your baby sleep and get you some sanity, get you some sleep at the end of the day as well. So thanks so much, Nicole. Is there anything else you
Thank
wanted to
you.
mention about your company, Dreamland, or anything?
Yeah, so you can find me at dreamlandsleepsolutions.com. You can book a free discovery call with me and we can go over any questions or concerns you may have, and we can onboard you and get your child and you sleeping through the night.